Okay. Stand. All right. Individual has, right, and you have this too. Client has what? What's the issues? What's the pain?
Low back.
Low back.
Outer glute.
Outer glute. All right. That's a compensation pattern of why would those two areas work harder than the areas around it? So why is the lower back and the glute, why is the pain, the tension is coming to the top of the glute and the lower back, right? Mm-hmm. So the student or person is experiencing a ton, this is for instructors only. I know, we're problem solving.
Okay, problem.
Okay. So if the glute, which comes up and around, you have the pelvis, so the glute attaches to the top, right? The lower back has two main erectors that also attach to the same area. So if you have your hips, you have left and right hip, you have erector, erector, you have spine, you have glute and glute. So this area becomes where the glute attaches and the erector attaches. It wants to attach in the same spot. So the individual experiences tightness and pain in that area where both pieces are attaching. Now, if we think about the problem in reverse, right? There's pain there. Normal thought process, go to that area to remove pain. Traditional Western kind of philosophy. But we want to think, why is the pain there? Why is that area becoming tight? Okay? What other things around the hips aren't helping enough to have a system of tension instead of one area of tension? So the lower back and the glute are doing all the work. What is not helping with work? Okay, inner thighs, hips, right? So everything, hip flexors, 300 core, so 360 degrees of the area, right? You want all 360 degrees to do some work. Generally speaking, if someone is exhibiting a lot of early back extension, right, in their patterns. So they're lunging, they're deadlifting, they're squatting, right? If they are sequencing the lower back muscles and only partial of the glute to do all of the work, those areas become overused. So the pain is an overuse of the same muscles over and over and over again. Now that could be from in patterning of lifting, or also could be a combination of that on top of lifestyle, on top of seating position, on top of how they do everything in the entire life. Those areas, right? So those areas are tight. We want other stuff to come along for the ride to allow those pieces to release tension. A massage is a manual tension release from those areas. Hitting the lacrosse ball in the glute is a manual release of the area, but that's a temporary solution because the nervous system, the brain already thinks, well, I know what you're going to make me do. I'm going to go back and make these areas tight because you haven't given me enough stimulus to allow the hip flexors, the adductors, the rectus abdominis, the obliques. And tricky question, the same lower back and glute muscles aren't strong enough because they are overused. If you see a lot of outer glute tightness, minimus, piriformis, medius muscles, side ass, okay, if those muscles are chronically tired and angry, that means the glute max isn't helping out enough. So if you have 3 phases of the glute, outside glute, that's why the mini band side steppy things, people love them, but the amount of people that need them, super low, because most people don't have enough glute max activation. They have too much piriformis activation because what is in that shortened or lengthened position the majority of our lives? The piriformis and glute medius from seated in a seated position, which also contributes to the what? shortened and weakened hip flexor because it's never strengthened in a long or shortened position as well. Is that making sense? Okay. So everyone should be, right? So the person deadlifting, the person squatting, if they're going into early extension, right, it's not that the exercise is wrong or that they are doing it wrong. Their sequence of muscle activation is off. Their glute max and both erectors and abs aren't all contributing to the initiation of work. Only the left erector or that left piriformis medius are doing all the work. The other stuff's not coming along. It's not doing the work with it, right? And what do we traditionally do? What does the general populace do with that? They have tightness here and tightness here. What do? 90-90 stretches. Anything wrong with a 90-90 stretch? No. But now we're taking an area that's already weak and overused and we're doing what to it? Which is also doing what? How does stretching work to create length in a muscle? How does stretching work? Right. It relaxes because what do? You manually add resistance or you add tension to an area and the brain goes, very well, I will take that away, right back. Right, because the brain doesn't, that's why stretching is such a temporary thing. You get like long term. But what did you not do? You did not tell the other pieces to be strong, nor did you tell that piece to be strong. You just told it, right, you just told it, shut up, tightness. And then you go do shit and your body's like, well, I'm going to go back to that tightness because that's what I subconsciously do to protect my joint. Yeah. So the body's going, this worked last time, I'm going to go back to that. But you're going to overdo it because you don't pay attention to not doing it enough. So I'm going to give you some signs that this is too much. Here's pain. Right? So students who have that, what do they need to do? Stop doing the patterns they're doing in volume or in total load or in frequency, right? Or they need to change the pattern, or they need a very specific warm-up sequence that when they get to that pattern, everything's sequencing in the right way. Yeah. Or, activate everything else, now do your deadlift. Oh, you feel fine doing it because everything else is happening. Second to that, you also want to let those areas know when they leave the session, hey, don't forget about us. So I want to do, it's almost like you want to do muscle activation, movement prep after at the end of the session. So if your hip flexor and adductor is weak, you want to finish telling the adductor and hip flexor, by the way, this is how you work, so that during recovery, the body is going back into that loop of like, oh yeah, that's right. I remember I have to use those muscles when I'm recovering in this 24 to 48 hours. Same thing with the other side of the back. Two erectors, left side's always pissed off. I should probably tell the right guy, hey, you should do some work. So we don't want to avoid using the back. We actually want to make the back work when the back hurts. It's only some of the back that's pissed off. We want all of the back to come along. Makes sense. So when you're thinking about pain, you're always thinking, why is the pain there? Now let me go up or downstream from the area. And in the case of the lower back, you have to think globally, think of a globe, and you think pain's here. What am I doing all the way around front to back, side to side, so that the tension, taking like a balloon, you pull on one piece of the balloon and there's tension there, right? And the rest of the balloon's not really helping out maintain that tension. So it's not like, what do I change about the program? It's like, what do I change about the individual inside of that program, right? Phase one, what's the best way to activate a muscle? What's the most effective thing we do to activate muscles? How do we flex them? Isometrics, right? Because an isometric is a low intensity exercise that the brain feels safe doing. And if the brain feels safe, the body feels safe, the body then reflects zero pain. Okay, that makes sense. So what do we want to do is we want to attack those areas first. What are all the opposite things of that hip? So if you're to lay on your back on the bench, okay, maybe if we had a slightly bigger bench, but this will be fine. Okay, which side has pain? Left, okay? So let's just look at what would left hip flexor strength be? How do we retest that? Straight leg raise.
Straight leg raise?
So keep both legs locked.
Okay.
Straighten both legs. Okay. Raise your, well, you can move up the bench. This is why an actual table is nice.
Yeah.
Okay. Raise left leg as high as you can, slowly. Okay, range of motion test, roughly whatever that is, less than 45. Now the other side. Look at the amount of range of motion on the side that does not have pain. This range of motion, a greater range of motion, is a response to greater strength. So if I relax this side, I want to create greater strength on the side that has a limited range of motion. Hip flexor. Did you just have this hip flexor released? Right? But it still has limited strength.
Oh, yeah.
It has length, but has no strength. How would we teach that hip flexor to be strong? Okay. So we lift her in range of motion.
Okay.
Put your hands on your thigh. Okay. Press your thigh into your hand with 25% effort.
Can I bend my knee?
Nope, because that changes the muscles. Okay. 1, 2, 3, 4, 5. Now rest your leg inside your hands. Rest. Okay. Now go back and do it again. Push. 1, 2, 3, 4, 5. Rest inside your hand. Look for more range of motion, if you can. See how range of motion has already increased? Now do it again. This is new in range of motion. 1, 2, 3, 4, 5. Okay, and now rest. That's 3 to 5 sets of 3 to 5 second isometrics. She's sweating, which means the body thinks that's a considerable amount of work. Because it is. Now, retest full range of motion. Matches the other side.
I can't see that.
Right? But did you feel it?
Yeah.
Feel the ease of movement?
Yeah. But I seriously full body sweat.
Yeah. Okay. So what's the other piece of the hip? What else does the hip do? Outside of flexion, it does what? Okay, extension, and what else? Rotation. It does that rotation in 2 directions, which are? Okay, that's not rotation. What are the 2 rotations?
In and out.
Internal, external. Perfect. Okay. So if we know that the external is the action that it's already doing too much of, we would assume the internal rotation is weak.
Yep.
Okay, so how do we find internal rotation of the same hip? 90 degrees. Okay. This is straight from the ceiling to the ground, right? If I take and I internally rotate, okay, and I find in range of motion. Now I'm going to use my hands again. But if I push here, I'm doing the adductor, right?
Yeah.
If I look at this joint and if I move the ankle in, this piece is creating internal, external. Right? Yeah. So I'm pushing internally. I have moved, technically the hip is going into external rotation. If you think about this looks like the 90-90. But the action, if I push this way, is I would be...
The action needs to come from my foot or from my heel.
Right, because that is the action of the internal rotation. Because that would be adduction.
Yeah.
That's still back into hip flexion adduction. So now you take your hand as close to your... Now this is where you get into an extension of your hand. Hold. Now find in range, push your heel into your hand through internal, right there. Push. 1, 2, 3, 4, 5. Rest. Look for new range of motion. Do it again. And push. 1, 2, 3, 4, 5. Good.
That's very uncomfortable.
Okay. Find new range of motion. In range of motion. Sometimes it'll be short and sometimes it'll be small, sometimes it'll be big. Doesn't matter. You're not, doesn't have to do, but you're just trying to think about new range of motion.
Yeah.
Push again. 1, 2, 3, 4, 5. Yeah, on a level 1 to 10, how hard is that exercise?
I was like, an 8 or a 9.
Because it's working super, super hard to make that action happen. So you have hip flexion, which is straight. You have internal rotation. What are the other two jobs of the hip flexor? Hip flexor and iliopsoas. So you have regular straight hip flexion, and then you have hip flexion at what? What's the other angle? What's the other series of muscles? 15 degrees outside the hip, right? You have straight and you have regular. So straight is going to be more quad and hip. Out to the side, once the knee goes outside the hip, what muscle do you take away? Assuming the leg is straight. Take the quad out of the equation when you have 15 degrees of hip adduction. So that's the actual hip flexor. This is quad and hip flexor. This is just hip flexor.
Oh.
Right. Okay.
Which is why we had me doing a lot of banded things.
Yes.
Which we did with him
Right.
like
Yes.
a while ago.
Right. So now, if I take that same, this will be even weaker, straighten your leg all the way. Okay, good. Now in there, I can play with externally rotated hip flexor. I can play with internally extended hip flexor. Okay, this being the weakest. Okay, now I do the same thing. Push.
Did you feel my
Hip.
leg shaking?
Now just push your hip up into
Wait,
the
I didn't
hand.
touch my hip.
That way.
Like that?
Uh-huh. Good rest. Yep. Okay.
Maybe I shouldn't hold my breath.
Yep, and it would technically be this angle. So you can, wherever you feel like is a good place for you to push. Now, if I'm the trainer, right, I can just be the hands. So I will let the person relax,
Okay.
push up into my hand,
Like,
up towards your face. By lifting the leg towards your face, lift up, push. 1, 2, 3, 4, 5, rest. Okay, do it with less intention. Less
intention.
25% effort, not 100%.
Oh.
Push. Yep, hold. Good. Look for a new range of motion actively. Good rest. Push. Rest. Good. And look for a new range of motion. Look at that. Push. 1, 2, 3, 4, 5. And rest. Okay? So internal rotation, straight leg hip raise. Outside with external rotation, that's the 3. And that's just from this plane.
So, but would you have somebody be doing, like, if we're going to do all these, we got to do them on the other leg too, right? You're not going to you're just doing it on the side that has pain.
Well, which side has limited range of motion?
Well, most
Because I'm
trainers
trying to-
got the same side thing.
I'm trying to, ideally, but I don't want to assume that it's a side of pain because it could not be.
So you would do the straight leg
Like test
lift
first.
You can,
see which
all
one
of these you can test left, right.
Okay.
And you go, okay, because if you do the internal rotation and they're the same both, you can skip it.
Yeah.
But if you do the straight leg one and one's like 30 degrees different than the other one, you're like, well, I definitely need to work on that.
Yeah.
From my experience with that, these are the 3 you always hit. Internal rotation, straight leg away with external rotation. Those 3 ones are the first 3 I always hit with isometrics. Eventually, you can load these. You can load them with weights, you can load them with cables and bands, and you can like continue to like load them progressive overload like everything else. Okay?
Wouldn't that even be like adding in the single leg like reverse squat that we do with the band?
Yep, exactly. So once this is,
That hip flexor, but it would
once these are normal and isometrics are normal, well, then I could lay on my back and I could put a cable on my ankle and I could do straight legs with 5 pounds and then 15 pounds. And that becomes a normal part of my exercise routine so that hip says and stays strong. It doesn't become weak and weak and weak. And then we have the cyclical repeating pattern.
So you would literally have somebody like you're like band around your ankle, you're like lifting.
You could do it. Yeah, you could do a band. You can do, I would think a constant load would be better off of a cable than a band because the band's only hard at the end. You want weights constantly hard. But in range of motion is the most effective part, right? You can also bump these isometrics up from 3 to 5 seconds by 3 reps to like 3 sets of like 60 seconds. I mean, you could go from 5 seconds to 60 seconds over 12 weeks, and that could be all you do is to make that, and that hip could become like bulletproof.
Ooh, I need a bulletproof hip.
That all contributes to that lower back pain because the hip is obviously weak. It's responding to the pain.
Yeah.
Right? So now it's the next piece,
Okay.
okay, is going to be rotation.
Okay.
Right? And so if you look at your ability to rotate your hip over, I just know that if you take this leg and you put it on this side of the ankle, okay, and you take this hip towards me, keeping both shoulder blades on the bench, try to get this hip to come towards me without moving your shoulder blades.
Mm-hmm. I don't understand. My body doesn't want to.
And shocker that there's something going on. So now push your hip into my hand with your lower back. So go to in range and push. This is lower body rotation. Rest. Good. And then do again all the way over.
I feel like my foot that's on the floor is like helping me.
Well, let's keep it relaxed.
Okay.
It doesn't really matter. Push your hip over. No, just your hip. The inability to communicate. Push, 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 push. Rest. See how hard that is?
Yeah, so hard.
Obvious sign of weakness. Okay, so you can do that, and obviously you can all this. You can be the hands. The person can be the hands. You can put blocks. You can put yoga blocks. You can put foam rollers. You can do PP9Ks, but you can kind of tell them positions to go.
Yeah.
I like to set up 2 benches
Okay.
so they're more comfortable on there,
Yeah.
and you could have them go through this stuff. But you could also have them do this stuff standing. You could just say push and push into a corner, push into a wall, but you're just getting that rotation piece going.
I don't feel like it.
Right. You can
With
like,
somebody, right? Exactly. That's what I'm saying. You could use the end of a foam roller, you could keep distance or whatever it is.
No, I don't have a problem touching people. Doesn't bother me. Where it is. And where I'm touching them.
I mean, hopefully it's a professional environment. I mean, massage therapists put their hands all over the place.
Oh yeah.
But
Matter of
it'd
fact,
also
I
be
just had his big old bear paw all over
right.
my
That would
hip.
also be, by the way, hey, is it okay to put my hand on your hip before we do this hold?
Hey, can I touch you?
Yes, no,
Yeah.
okay.
Yeah.
You know, because you're just all your hands is just blocks. You're not doing anything.
Yeah.
You're just giving them places to say push into, push into. So I could even hold a yoga block onto your hip and you say push your hip into the yoga block, and I'm not actually making contact with you, just as like a barrier from. So they're just looking for feedback. You're not doing anything with your hands. You're not pushing.
Yeah.
You're not manipulating anything. None of that stuff. Okay. So the other thing is going to be sit, face the camera. Okay. Put your arms across your
4
chest.
minutes.
Okay.
Well, like
Arm cross. Okay. Good.
here.
So if there's pain here,
Mm-hmm.
okay, that generally means that if I wanted to stretch that area, I would go into trunk flexion, okay, and then I would go into rotation. That lengthens that part. You should avoid wincing at all time. No matter what, we never move into pain. So you would say, well, go into that position before pain, wherever it is, without pain.
It's not painful. It's just a stretching. Like it's just.
Okay.
I can feel it.
But as long as there's no pain, then it's fine.
No, what is-
Okay, so now this is another part. This is the weak pattern because look at the range of motion and you can kind of see how much she's rotated and she's flexed. Now, if she were to reset, she goes into flexion and rotation to the other side. Watch how much more range of motion there is. See how much bigger that is? So we want to teach those muscles that it's okay.
Oh.
Okay, so now you'd have flexion, rotation, and now push into my hand. This is an ab isometric. Rest. Okay, look for more range of motion. Push. Rest. And more. And push. Rest. Super demanding.
I'm completely sweaty.
Completely sweaty. It's all those other pieces. Now, so you just start going through everything. You just start thinking about, okay, if whatever things that they want to naturally stretch, I'm finding those in range of motions without pain, and I'm flexing the opposite way.
Yeah.
that is a warm-up routine before they get back into all their stuff.
Yeah. Yeah.
Right? That could also be done with a cable. You could say, grab a cable, hold, and then wait until you feel something. Or you could put a foam roller, or you could put a block, or whatever you wanted to put, or you could put a barbell. You could have them do an inverted row bar, like the bar but back to your left, right? You could have them push into the bar with their chest for ab isometrics. You may have to move the bench because now you're thinking opposite. If your hips are square and I'm moving you, if the bar is normal, then I have to start moving the person's hips and legs around to find the range of motion. Right? Okay, so we know we have ab, we have rotation, we have hip. So we need to do glute max, and we need to do the opposite side of the back. What's the opposite side of the back? If arms across your chest, if extension, right? If this side wants to get cranky with extension, if I look at what's this rotation, okay, and then what's the other rotation? See how much more giganticore that is?
Gigantic.
Okay, so now she's in extension in her lower back. She goes into the rotation that's limited, and now I'm going to create blocks that become the position for isometric. Push into this hand with your abs. Go. Push. Rest. Look for new range of motion. Push. Push. Rest. Look for new range of motion. I'm staying into extension and lower back. Push. Rest. One more. Look at that. And push. Make sure they're not compensating through the lower body. Rest. Okay? So now we've equaled that side of rotation in extension of the lower back. So this is extension, flexion, two different things happening because I'm teaching the lower back and rotation. I'm teaching the abs and rotation. Okay? We have glute max, and there's a little bit of side bend which you can play with. It's like, say that this person is in extension. What does side bend look like without compensations? If there's pain, or if there's other side. See how this one's limited, right? This side's limited.
That side doesn't hurt.
Right. She winced on this side.
This side was way
Right.
uncomfortable. This side I'm like, meh, but it's not as far.
Right. So if only move without moving into pain, side bend.
Which way do you want me to go?
Either way. Okay. It's very similar, right? There's not a huge difference left to right. But that's why we do so much anti-rotation side planking work, is to try to get those obliques to help out. But you can do the side plank from here. You can just say, don't let me push you over, right? And now she has all that oblique work happening. The same thing from here. Don't let me push you over. Oblique action happening, right? And you can do that with a bunch of stuff with isometrics. All this 3 to 5 by 3 to 5 stuff. Okay. I'm going to put it on YouTube. And the last one, glute max. So lay on your stomach. Yep. Because we want to isolate all the pieces away from glute max, right? Glute max is in charge of, what's glute max's number one job? What is the glute max number one job for the hip? Its biggest job. Why do we do so much hip thrusts? Hip extension. How much hip extension range of motion is there really once we're already, this is 0, right? How much past 0 can we go? Not a ton, but if I there's no compensation through lower back, raise your, which one is pain? This is pain? Yeah. Okay. So raise this leg up, keeping the leg locked. This one. Yep. To wherever she can. Good. Rest. And now this one. Okay. A little bit of range difference. Not a huge difference, but you feel the difference in, right? And okay. So find in range of motion with this leg. Now push up. Now you want to make sure they're not pushing out. So if you put your hand on the inside of their leg and push up, they could only use glute max. They can't let any of the external rotators help. Rest. And then do it again. Okay. Now if she internally rotates her foot, she's going to even kick out less of the rotators to help out. Push up. Yep. Never move into pain. Good? Right. Right. And then up again. and push 1, 2, 3, 4, 5. As a reference, just do this one for 1 rep. See how much strength there's there? Obviously, that glute, that hip, that ab. Now, if it's chicken or egg, we don't really know. Is it that because the glute, because the ab, because the hip are weak that there's pain? Or is it that there's pain and now there's weakness? We don't care. Doesn't matter. So if the student's like, well, is it because my thing's weak? No, it doesn't matter. We're just going to make everything strong. And if everything is strong, then there's no pain.
Just everything around that muscle that's overworked, tired.
Right. Okay. Now stand up, shake it out. Right. Now, has pain and tension decreased from that side of your body? Because we told the brain everything's okay by telling you everything around it, everything's okay.
Well, so my pain, I don't know what he's experiencing, but like my pain specifically, like I'm good. If I'm like moving, great. You make me sit down, like forget it.
Right.
Like, it's almost to the point where like I can't sleep.
Yeah. Now we're getting into like even more complex systems. But
yeah, but like all of this, I need all of it. Are you gonna hang out with me every day? Every day.
So
and for full body sweat, holy moly.
you can go through one sound, you can do that one set of everything, you can do that banded, but just think about it. Make the hips work, glute max work, make the other side of the back work, make the abs work, okay? And then go into your patterns. You know how much to do inside the session when they stop doing the sequencing. If they get 2 sets into their deadlift and you start seeing the old sequence come back, you're done with that exercise. They've hit their tolerance. That's why there's nuanced personal training. That's why it's like, it says 3 by 5, got to do 3 by 5. No, if he does 1 set of 5 and then 2nd set and he gets 2 reps and he's already back to his old patterns, move on to something else because we've already overloaded the stimulus to go back to his or her default loop.
Right. So you would have the student do all of this stuff before
Yeah.
do anything else.
Yeah,
And
and
like before movement prep or like do movement prep and then
same difference.
doesn't matter.
Right.
It's movement prep.
Right. Yeah, shocker. What are we doing? We're getting glutes on, abs on,
Or on.
core on. What does that sound like? Movement prep. Right? And then you can take all that stuff and you can load it. So you could do back extensions off of the hip lift pad, like once there's like little pain. You could put his hips on a hip lift pad, make him do back extensions in that same rotation. You could do reverse crunches for abs. You could do cable chops. You could do cable crunches. You could do the weighted hip flexors. You could do glute max loaded with a kick or with a band or with a cable or with a ankle weight. You do all that stuff every time they do it before they're patterning. And then you watch them lift and you make sure they're not going into the same squeezy lower back hip thingy.
Summary? That was it.
Summary, always look upstream or downstream from pain and don't think super linear or black and white because it's usually super nuanced.